In fracture repair, both the periosteum on the outside of a bone and the endosteum, which lines the central canals and the trabeculae of spongy bone, both of these areas are important as a source of osteoblasts and osteoprogenitor cells, which will help heal an area which has fractured. After the break, a blood clot forms known as a fracture hematoma, which will give some slight stability to the area and also help to contain bone fragments. When a fracture occurs, this not only kills bone tissue, but it interrupts the blood supply. Because bone is very vascular, as cells lose their oxygen and nutrient supply in this blood, then the area of dead bone expands. The osteoprogenitor cells, or osteogenic cells of the periosteum and endosteum, can now divide to become the cells which will repair the area. These are stem cells, so they can differentiate into different types of cells, both osteoblasts and chondroblasts. Osteoblasts will form if there is an existing blood supply which is undamaged. If there is no blood supply, then the osteogenic cells must form chondroblasts because cartilage is avascular. Cartilage tissue can survive in an area without a blood supply, while bone tissue cannot. The chondroblasts in the fracture area then begin to make cartilage, a type known as fibrocartilage, and this cartilage will form calluses inside the bone, known as the internal callus, and outside, known as the external callus. These are made of fibrocartilage. As a blood supply is restored, then the osteoblast will begin to make bone matrix. The cartilage calcifies and will die and be replaced by bone. This forms a bony callus. Although the bony callus is certainly an improvement in the damaged area, it is not identical to the bone tissue which was there prior to the fracture. And so osteoblasts and osteoclasts will then begin to remodel the area and restore it to its original condition.